Hi, I'm Dr. Zack Mills, owner and Chief Veterinarian at Tiger Tails Animal Hospital in Duluth, Georgia. What we want to do today is talk about dental disease in the dog. Our first video is going to be about how does dental disease develop and the problems that it can cause. If we look up here, we have a model of a dog's mouth. And just like with you and I, over time you get a plaque and bacteria that adheres to the teeth. When this plaque develops a film, what can happen then is calcium builds up on that plaque and causes calculi. That calculi causes the teeth to get roughened and causes irritation right at the gum line. But more importantly, what can happen is that calculi develops, it pushes its way down along the edge of the root, causing the sulci or that gum to peel away from the root of the tooth, causing both inflammation and pain. Okay. Here we have an example of a normal tooth. Notice there's no inflammation along the gum line. The tooth is white and bright. Now, on this tooth, we're starting to see mild to moderate periodontal disease developing. Notice the inflammation. Notice the calculi that's developed right here and how it's gotten up underneath the gum line, causing inflammation. That would be extremely painful. You can imagine having that on your tooth, how painful that would be. And more importantly too, the breath would start getting bad right now. If you look at the dog's mouth from a distance, it doesn't look that bad. But if you look up close, you'll see that it's there. And you, like I said, this dog licked you in the face, you know that you would have periodontal diseases coming up. Here we're moving where it's getting a little bit worse. Notice even more inflammation up in through there, and we're starting to see a little bit of the gum receding right here. More importantly, as we're going to more advanced situation, I'm getting it to where I've got even more of the root being exposed. The problem that you deal with in this is I may not be able to get this gum to adhere back down onto this area, and we might be getting to a problem where we might be losing the tooth at this point. Again, the dog's breath would be extremely bad, and you'd probably see the dog starting to have some problems eating the food with this situation. Now, here's what's happening when we let it get out of control, to where we have severe periodontal disease, severe inflammation and infection along the tooth and along the root of the tooth. Notice how much the root has gotten exposed both here and here. See, but this is basically pus. The smell of this would be awful. More importantly is this can be life-threatening to the dog because all this bacteria, there's a lot of vasculature that comes to this area. So all this bacteria that's here can be absorbed by the body, and when that bacteria gets into the bloodstream, what it can do is it can go down to the heart valves, and it can even go to the kidneys, causing valve problems and infection in the heart muscle itself or in the valves of the heart, or go down into the kidneys, causing infection in the kidneys and damaging the kidneys. So as you can see, this is what can happen in the mouth. So it's very important for us to talk about and go into how do we, number one, take care of this if it's gotten bad. And that's what we'll do in our next video, is talking about teeth cleaning and what we can do to keep this from progressing and getting worse. But then more importantly, in the third video, what we're going to talk to you about is prevention. What can you do at home to keep this from occurring?